could just remind panelists to mute yourselves, because otherwise we will be able to hear you. We would like to ask anyone who has a question or an observation over the course of the meeting to please submit it through the web chat function on the webinar. And we will be taking questions and answers towards the end of the session, but we will be taking them in written form and then sharing them out with the participants. So I will just get us started. I'm so pleased to be able to be here and speaking to you. We had been thinking about when to get this meeting organized, and the end of the year seemed like a great time to do it, since that will be able allow us to really cap off what we did in 2015 and tee up what we're going to be doing in 2016. As you know, Global Health Council has been rebuilding since 2013. We have just had an incredible ride, an incredible experience, and are very pleased with what we've been able to do for members, for the global health community, and how we've been able to contribute thus far. That said, we continue to grow and evolve, and so we are looking at this as part of an ongoing process, and we are particularly looking forward to 2016 because, as some of you may recall, when we relaunched in 2013, we unveiled a strategic plan for 2014 to 2016. So next year we will be reviewing progress and refining the plan for the 3 years to come. So that means that we will be setting up some very structured opportunities during the year to call for member feedback and suggestions to hopefully help us improve the way we do things, be of better value to members, and of better value to the global health community at large. So with that, I will get started with the presentation. We will be going through briefly a report that I will be giving about our activities and our members. And then we will shift to the board report. Dr. John O'Quick, our board chair, is on the line. We will hear from him as well as from Mark Milligan, our CFO, and Pat Daly, who is the chair of the nominating committee, who will give us an update on the board profile. And then finally, we will hear some logistics from our membership engagement manager, Liz Colway, who will give us some information on the member portal and the membership calendar. And then we'll be able to break for questions and answers. So for the President's report, first of all, just to note that we are obviously broadcasting a PowerPoint presentation here that we will be speaking to. This will be made available following the webinar, and we encourage you to use it as a reference point. In addition, many of the items that are going to be mentioned during the President's report also exist in more in-depth formats on our website. So I encourage you to go to our website to see the resources and news that live there. So overall, Global Health Council has organized its work into 3 large components. The first is policy and advocacy, the second is connections and coordination, and the third is member engagement. We feel that member engagement cuts across really both of the other 2 sections because at all times we are trying to really identify and enhance how our members can engage across the global health landscape and how we may be able to provide additional or unique opportunities to members to be able to engage in areas that are of high priority and importance to them. Some examples of our policy and advocacy work during 2015 were that we continue to engage with the global health advocacy community in Washington, D.C. There are a number of roundtables, working groups, coalitions, and alliances working on particular global health issues. We engage with them in a one-on-one vertical manner, but also really try to bring together those communities to be more complementary and collaborative and to have an enhanced impact when we talk about how all of these different issues contribute to the whole of global health. Of course, that work is in conjunction with the work that we do with the U.S. Congress around investment and prioritization of global health within the U.S. Fiscal year budget, including recommendations on appropriations and policy recommendations and legislation recommendations. We launched the Global Health Briefing Book in early 2015. This was for the new Congress that was coming in, and this is something that will take place every 2 years. And the Global Health Briefing Book contains briefs on all the different issues that are contained as line items within the global health budget in the fiscal year budget of the U.S. government. That briefing book is online, and you can find it through our website. We initiated what we call a policy scrum webinar series in advance of the World Health Assembly, and we were able to hold 6 webinars where we were able to dissect and really analyze upcoming issues that would be treated at the World Health Assembly, and please look forward to that again in 2016. We've added an advocacy hub to GHC's website where we post advocacy resources, and so really trying to be as collaborative as possible, bringing resources in that others have made available publicly so that our members don't have to go to many places to find many different resources, but can go to our website to find a collection of resources in one location. And we also have been really working on providing strategic opportunities for members and the global health community to be able to get information, comprehensive information, and opportunities to engage with a number of global initiatives, including the Global Financing Facility, the Global Health Security Agenda, and as well as a number of convenings that we've done around accountability and engagement. In particular around civil society and how civil society is involved in accountability, but also expanding that discussion to multi-stakeholder accountability and what is the role of the private sector in holding itself accountable and also in contributing to the global health landscape and goals. Next slide, please. With connections and coordination, we've held a number of events. We've really tried to tailor our events to be accessible and attractive to global health professionals working at all levels. So we have monthly salons where we typically have people who are, well, actually at all levels, again, of their careers, but young professionals coming to those salons to be able to meet other people working in global health and discuss the issues. We hold the Future of Global Health event each April, and that will be coming up again in April 2016 on April 14th. That is, we call it the Unconference, and it is a big networking event where we bring together 4 generations of global health professionals to discuss the most pressing and important issues facing the global health community. That also is an opportunity for young professionals to meet with established professionals and discuss career paths and think through together what careers in global health will look at as we evolve into this Sustainable Development Goal era, and how we need to be addressing both the technical and professional and career needs of those professionals to be able to meet the challenges that we've set for ourselves in terms of attaining Sustainable Development Goal 3, which is the health goal, as well as all of the related targets and goals across the agenda. We also hold an annual symposium. We've now done that twice, in 2014 and 2015. This was held last month here in DC. It was really a wonderful day where we looked together at how we need to be working differently within the Sustainable Development Goals to be able to attain the ambitions that we've set for ourselves. We also have really been enhancing our communications, and I hope everyone on this call is getting our newsletter. If you are not, you can sign up for it at the bottom of the landing page of our website. And we encourage members to submit information that they would like to be shared through the website, through the social media, and through the newsletter to really get a large reach on visibility around your events, your achievements, and your plans. Next slide, please. Thanks. Referring to our social media platform, we've got a growing social media platform on Twitter and Facebook. I will admit I am not a communications expert, but the communications folks on our team tell us that these are very good numbers, and we are seeing a regular increase in the numbers of people we are reaching through both Twitter and Facebook. As I said, we also have the newsletter going out, and that reaches another large group of people. Next. And so for member engagement, again, it cuts across everything we do, but we do have particular member benefits, including being the opportunity to take part in delegations to the World Health Organization Executive Board meeting, to the World Health Assembly, and we just actually had a meeting of the WHO Non-Communicable Disease Coordination Group, and we had several GHC members attending that. We also have a number of meetings every year at the UNGA and can facilitate access to ECOSOC events. Next. So I'm just going to, I've touched on a number of the membership benefits in what I've already discussed, but just to say that you will be receiving, your point of contact for your organization will be receiving the member benefits page in the request to renew for 2016, and the membership benefits table that you see before you, it can also be found on our website. We hope that this really helps to clarify and bring home the value of the membership with GHC. Next. And again. Yeah, thanks. So in 2016, we will be doing a number of the things, most of the things, all of the things that I have already mentioned. But we also wanted to bring out a couple of particular things for 2016. One is that, as I referred to, we've adopted the Sustainable Development Goals at the UN. In 2016, we will be working with the global community to really think through what the means of implementation are for the global goals and how to best coordinate and harmonize our work in order to have maximum impact. Also in 2016, we will really be looking at global health advocacy within the election cycle and the presidential transition, both in terms of coordinating the advocacy community around how we interact with the candidates and with the transition team once the election is completed, and also thinking through what are the recommendations that we and our members want to make sure that the new administration is aware of as they start to form their global health policy platform and approaches. We will continue working with civil society engagement, with multi-stakeholder partnerships. We'll also be working on global health security, and we will be expanding the Women Leaders in Global Health Initiative, which we unveiled at the November symposium. We will continue to really be thinking through what membership benefits look like and how we can really maximize the value of membership in GHC. Next. Just quickly to show an indication of how our organizational membership is diversifying, GHC does have a big tent membership policy, which means that we have members from international development partners, be they nonprofit or for-profit, as well as corporates, research, philanthropy, academia, and others. So here you can see that we are starting to see a real diversification of our membership base. Next. So I'm going to turn the speaking role over to John O'Quick, who will be starting us off on the board report. Jono, over to you.
Okay, great. Thanks very much, Christine, and congratulations to the whole GHC team. It's a small but very powerful team, and it's really stunning to see the range of activities and outputs from the last year. GHC's evolved a lot since 2013. You may remember that GHC took the summer and fall of 2012 off and reopened again in January of 2013. And there was a lot that happened in that first year in terms of getting things organized and being sure we had the resources to begin bringing on staff. So the achievements that you've seen just now, that's really Dr. Christine So has been on the job now for just over 2 years and building up the team, and it's really a tribute to Christine and actually all the members that as much has happened as it has happened. Among other things, we had the biggest delegation at the World Health Assembly ever, but also bigger than any other delegation, which caused a little bit of discussion. And I just think this attests to the relevance of an organization like GHC, to the proactive engagement of the whole global health community and the value of a collective voice. We're really committed to continuing to improve and grow the organization and take it to fulfill its mission. To this end, one of the things that has happened over the last year is to develop 3 policies about the ways in which we work. So we have reviewed or developed where there were policies reviewed, but really put in place 3 key policies: a policy on corporate and commercial and corporate engagement. It's clear that the private sector has been an important part of GHC's global health impact and contributes a lot to health around the world. What we want to do is maximize the Big Ten approach and the benefits of working with the private sector, but do it in a systematic way. So the policy covers the sort of contribution, sponsorship, memberships from corporate entities, looks at issues around conflict of interest and how we carry out due diligence to be sure that we are partnering with organizations that share our values. We have a set process for that. We also have some limits on the sort of commercial and corporate organizations that we'll be engaged in, and how we communicate that, how we monitor it, and what sort of agreements we have. And having that level of clarity has been really helpful, because there are lots of positive sides, and there are also some cautions in working with the commercial and corporate sector. The other area that we've looked at is GHC partnership with the U.S. government and other government agencies, so that it does provide in the bylaws for our engagement with governments, and obviously a significant part of our advocacy and education work is around engaging and getting maximum support from the U.S. Congress and from others. And so policies about how we engage with the government entities and individuals employed by the government and all, that's in that policy. The third area is having a voice, how we take positions on key issues in global health. And some of the kinds of things that we would want to take a position on and have a voice on is the funding levels for global health policy issues, events, campaigns around specific global health goals. And in a member organization, it's really tricky, because we do need to have a collective voice and to really stand for something, but we also need to do that and develop those policies and those positions in a way that that recognizes that it's a diverse organization and that not all of us individually will share the same views on particular issues. The kinds of ways that we engage: sign-on letters, op-eds, blogs by GHC director or staff or board members, advocacy days or Capitol Hill days, events and conference sponsorship, and participation in different campaigns. So the policy looks at the policy that we've developed for position taking looks at how we make recommendations for U.S. government funding, how we engage in different health issues, and have a clear process for how we do that. Let me give you just 3 examples of some of the positions that we've taken. One is with the Maternal Newborn Child Health Roundtable, a letter to State and Foreign Ops Committee urging adequate funding levels for maternal and child health within the USG fiscal year budget, and really making a clear case for why that's important. We also signed on to the letter calling for the Global Democracy Promotion Act, which would prevent reintroduction of the global gag rule, and so we spoke out for that. And Christine So authored an op-ed in Roll Call on the promoter calling for a fact-based quarantine policy, and really putting cautions in around some of the real reaction around the Ebola epidemic. So those are 3 examples of the policy on taking positions. So those 3 policies have been an important part of just putting structure in the way that we work. GHC members are really critical, and the financial support is important, but even more the contributions of all the GHC members as thought leaders, policymakers, advocates, and that engagement. I mean, we're a platform and a place for people to come together and put that collective voice in and really be able to speak as a community on some of the really critical issues that are facing us in global health. With that overview of the policies, I'm going to hand over to Pat Daly, who heads the nominating committee, a GHC board member, and she's going to talk with us a little bit about the profile of members. Actually, am I handing, I hate to ask this question, am I handing over to Pat or am I handing over to Mark?
Hi, Jono. No, actually, Mark is up next.
Okay, well, good. You see, okay. Over to Mark, who is Mark Milligan is the Chief Financial Officer for Global Health Council. He's actually based with Global Impact, and one of the beauties of our model is the secretariat model, where we get top quality help in different areas and staff in different areas, but only as much of their time as we need. So, Mark, as our CFO, over to you.
Thank you, Jono. I thought I was going to get out of it for a second, but I really wanted to just briefly go over the 3-year progress of Global Health Council that Christine and Jono have actually touched on. Global Health Council has gone 3 audits since the basically the rebirth of Global Health Council, and all 3 of those audits for the 2012, 13, and 14, and the upcoming 15 are proven to be showing a great growth in the Global Health Council. For the 2012, 13, and 14, the audits have all gotten a clean opinion, and if you would like to, which is the best opinion that an audit can have, and if you would like to review the audits or the 990 tax returns of the Global Health Council, you can always visit the website at globalhealth.org under the About Us and Operations section of the website. Global Health Council looks to have all the transparency factors in place, so we always make those reports available. If you look to the actual growth of Global Health Councils over the past 3 years, on the next slide you can see the annual revenue of the council. The annual revenue has steadily increased from year to year as the Global Health Council has become more robust in its programmatic services as well as growing operationally. And the Global Health Council could not be doing that without sustaining members such as yourself in helping spread the message of the Global Health Council worldwide and to support membership. With that said, I can turn it over to Pat Daly for the next section.
Hi, thank you very much. So I wanted to just go over the board, right? The board of directors really provides some oversight for to assure the vision and the goals of the Global Health Council are met. But perhaps since Christine has been on board for the last 2 years, perhaps our role has shifted quite a bit to being a board that works very closely with her and provides the oversight and approval for the financial resources and leadership for the work of the Global Health Council. We are a working board, but the bulk of the work and the heavy lifting is indeed done by Christine and her team. The board is made up of we're 19 board members at present. As you can see from the slide, it's quite diverse. It represents people both from the North, the U.S., and Europe, as well as from some of the developing countries. It's a breakdown of people coming from the NGO world, philanthropy, universities, private sectors, and the government, as well as some individual members. At present, as I said, we're 19 members. There are 7 board members who are ending their term. 6 of the board members are standing for another term, so we are filling 1 additional seat. So last month the board met and we had decided that we were looking for a candidate that fit the profile of somebody coming from the infectious disease, HIV/AIDS world. So in October we sent a call was sent out to the membership seeking candidates, and the board also met and identified several candidates. So at this point we're very close to identifying a candidate that would fill that the board would put we would put forward to be ratified by the membership. So in the next week or so, we hope to send out a final slate that would consist of the current the 6 board members who are standing for a second term and a new member. I think that's it for the board profile. I don't know who, sorry, I'm not sure. Logistics, I guess. Liz, are you?
Yeah, thank you so much, Pat. Yes, so I will be handling the logistics section of the webinar, and just going on to the next slide. You might have noticed that new for 2015 is the GHC Online Member Portal. And from this slide, you can see that there is a new member login section to the homepage of our website. And really, this member portal has several purposes and functions. For example, you can update your profile with key contact information for yourself if you're an individual GHC member or for your organization. You can also put other contact information such as communications contacts, advocacy contacts, etc. You're also able to make donations, track attendance at major GHC events, and probably most importantly, manage your membership. So everyone who's a current member should have been receiving emails from us regarding renewal for 2016. And in that renewal email, there are links to set up your account and renew online. So I encourage everyone to click on those links and follow the detailed instructions that are there. In addition, you can also just go directly to our website and create your account online using kind of these steps right here that are displayed on the screen. And it'll prompt you to fill out a new profile and again fill out all of that contact information. And I'd like to make a special note here for organizational users that just don't be alarmed if it says that you don't have an active account right now. That's just because it is a new system. So everyone, regardless if you're already a member, will have to set up their account online. And our staff will be sure to link your organization account or your new organizational account through our member portal with your existing one. Another note for organizational members, if you do choose to pay later, the email confirmation that you receive will also serve as your invoice so that you can send on to your billing department. And as always, if you have any questions, feel free to reach out to us at membership@globalhealth.org, or you can visit globalhealth.org/join. And like I said, you will find detailed instructions there on how to set up your account. Great, so I guess from here, if anyone has any questions, not only about logistics, but anything else that was mentioned during the course of this webinar, I invite you to put your question into the chat box and we will respond to it.
Hi everyone, this is Christine again. While we're waiting to see if anybody has any questions to contribute, I will just say that I encourage you to keep a lookout in the early parts of 2016. We are going to be getting out a calendar for 2016, which will give an overview of events that are already identified for the course of the year. We are really hoping and dedicated to the idea of increasing visibility and predictability about what you can expect from GHC. That does not mean that we are going to be locked into something that cannot change, but at the same time, we want to make sure that you can put events that interest you on your calendar ahead of time to be able to ensure your availability at those events. Again, we're going to be really trying to build on what we've been able to establish thus far, and I think 2016 is going to be really very exciting.
Christine, this is Jono. Let me put you on the spot a little bit here.
Sure.
A year from now, we are going to be about 5 weeks post-election. We have quite a bit of period of time between now and then. And any reflections, I know we haven't kind of formalized all of this, but what are it's really important that we have a Congress that's as aware of the issues as possible, and that we maximize whatever opportunities there are with the administration. Any thoughts on what GHC members, what opportunities might come up to engage, and how we might help to make the most of the outcome?
Yeah, thanks for that question, Jonna. We've actually been talking about that a lot for the last couple of weeks. And GHC right now is anticipating a number of ways that we're going to be engaging around that whole process. First of all, I mentioned the Global Health Briefing Book earlier. We will be doing a new edition of the briefing book, which normally will be unveiled early in 2017 as the new Congress and the administration come in. And so that is a resource that will be available online. It will be probably available in printed edition as well, and we will be having events around the unveiling and launching of that resource. And that's something that we certainly will be involving our members with in terms both of development and the launch itself. The briefing book is developed working with the various roundtables, working groups, coalitions that are active in DC, and also with folks who call into those groups. And we really try to develop a resource guide that reflects as closely as possible what these coalitions of global health actors are thinking and recommending. So that is really a group effort. In addition to that, we are going to be taking on a project which is still coming together, so I'm going to be a little vague around the edges of what it's going to look like, but basically we think that it is important for us to gauge what has happened in global health under the Obama administration. What have we seen success on, and what have we perhaps not seen success on, where we still feel there is really need for attention and investment. And so we are hoping to provide an analysis that gives a baseline for the new administration on how we're doing on global health from the U.S. government perspective, and then, of course, adding those recommendations for what we would hope the new administration, whoever that may be headed by, that they choose to invest in. So that's another piece that we're going to be developing that will very much be something that both members and the larger community will be involved in. Finally, and again, this really is, this will depend obviously on how the election goes and you know, what kinds of relationships we can establish with whomever ends up being elected, but we certainly will be actively reaching out to the transition team to be able, and possibly to the candidate teams prior to the election, to be able to provide recommendations and input and information around global health issues to help inform the development of platforms as well as positions once the new administration comes into office. So those are a couple of examples, and those will definitely be taking shape over the course of the year. Let's see, we've got a couple of questions that have come in. The first is from an individual member who says, I am a retired individual member of GHC living outside the DC area. Will you kindly comment on what is in it for me as I consider renewing my membership? Thank you very much. So GHC is rather unique in that we do have organizational members and individual members. And it contributes to the richness of the GHC membership platform, but at the same time we really do have the challenge to think through what is a value proposition both for organizational members as well as for individual members. And we are really, again, as I said, we are evolving and we are trying to enhance membership benefits for all of our members, be they individuals or organizations. In terms of individual membership, I think that what we've been able to show thus far and what we are certainly going to be trying to enhance over the course of the next year is that individual members will have the opportunity to participate in events that GHC hosts. We have individual and organizational early bird pricing for events. We have announcements that are limited to our membership, be they individuals or organizations. And I think what I hear most frequently from individuals that they see in terms of real benefit from GHC is that when you're by yourself, whether you're retired or you're a consultant or you're just interested in global health, it's difficult to know what is going on in the community. And actually we have a close colleague who was working for a very large organization. She's become an independent consultant recently and has said that, you know, her membership at GHC has really been critical for her because by branching into our, you know, reading our newsletters and coming to our events, she's able to really stay abreast of what's going on. And so I think that that's what individuals get out of membership with GHC. And we have, you know, I really enjoy, for example, our monthly salons. We will have individual members who come to the salons, and we're able to talk to them on a one-on-one basis. And I know that some of the input that we've gotten at some of those during some of those conversations has really helped to shape our thinking and shape some of the issues that we are paying attention to as an organization. So while individuals are one rather than organizations that perhaps seem very large, at the same time individuals may have the chance to have one-on-one access to either GHC leadership or leadership across the global health spectrum that would be difficult to get otherwise. I'm going to go on to the second question that we've gotten. Congratulations on the many activities listed for the past year. Can you comment on the outcomes or results of these activities? So that's a great question, because one of the things that we've been talking about at the board level consistently over the past 2 years is what are the indicators that we need to be following to know what kind of an impact that we are making. And for anyone participating on the call who works in advocacy, I think that measuring the impact of advocacy is we all know is a really challenging thing to do, because we can recommend as much as we want to Congress that they should set appropriations at a certain limit, for example, but there are going to be so many confounding factors on the final decision that we can't for sure say that thanks to our recommendations they made a decision or didn't make a decision. So that is a challenge. So that said, one of the areas that we've really been looking at in terms of our impact is precisely around membership engagement. So looking at has GHC been able to either influence processes going on at a global or national level, or provide opportunities so that members can engage in a way that they wouldn't have been able to engage otherwise. And an example of this that I'll give you is the Global Financing Facility. The World Bank, USAID, and a number of bilateral governments and other partners, including the Gates Foundation, have launched the Global Financing Facility for Reproductive, Maternal, Child, Adolescent Health, RMNCAH. And for the past year, GHC has been working with a wide coalition of actors interested in this financing facility to convene meetings with the World Bank and GFF leadership to provide an opportunity for members of civil society and the private sector to engage with that leadership, to ask questions, to pose challenges, to really try and explore what this means for the global community. And I think over the course of the past year, have held 6 or 7 of these types of convenings, most in the United States, although we were asked by the World Bank to hold a convening with Global South Civil Society at the Financing for Development Conference in Addis Ababa in July. That was a very successful consultation, and I think it was there that the bank really heard loud and clear that Global South Civil Society does not feel like they were being adequately engaged in the process or informed about what was going on. So, through our actions, we know that we have been able to provide space for civil society and the private sector to contribute to the way that the Global Financing Facility has been developed. And that is ongoing, and right now actually we're engaged in conversations about what civil society engagement platforms will look like that are being thought through by a number of global agencies, and really putting an emphasis on the need to align and harmonize the way that these are organized to avoid duplication of effort and to really increase maximum impact of the time and effort that everyone puts into these types of platforms. So that's perhaps a rather lengthy example, but I think it's a good example of how we are trying to use the weight of our membership behind us, to use the fact that we have a multi-stakeholder big tent membership, and to use the fact that we have member experts across the whole spectrum of global health, to open up discussions to achieve better policy, better advocacy, higher levels of investment, and also to make sure that our members are really fully or engaged as fully as they can be in these various global and national processes. Let's see, we have another question that's come in. Is there a fundraising strategy for the Global Health Council that you can share with us? Yes, we are, we are working on our fundraising. As you can imagine, after shutting down in 2012, we've really had to rebuild our membership, and that is, our membership is growing consistently. But that I can only tell you all that the membership dues are incredibly important to us. They give us a level of security that allows us to be able to do our work and to make independent decisions, that is, decisions independent of donor priorities, that we feel are the most useful and needed by our community and by our membership and by our members. We also are, have been making contacts and really trying to build relationships to bring in grants that would be either unrestricted or more project-oriented in nature. We are, we do have some grant funding. We are hoping to grow that grant funding. I will say that that is has been a challenge for us because some of the foundations that funded GHC 5 or 10 years ago have now completely reoriented their efforts into other strategic areas or into funding only for work that is taking place directly in the Global South. So that's been a challenge for us. We are also...
Christine? Hi, this is Jono. Can you flip us back to the pie chart of the funding?
Liz, can you do that for us, please?
Actually, yeah. Okay. So just to point out in terms of the trend line, in the first year when we were small, the dues were the lion's share, and as we've more than doubled, actually about triple the budget in the 3 years, the slice that's grown the most has been the grant slice. So maybe, Christine, you could talk a little bit about the trends, because I think this is really encouraging in the sense that we relaunched the Global Health Council through the interested members group, where a number of interested members committed to get it up and going, and thankfully carried the lion's share in the first year. But it's actually balancing out nicely, and you're growing the grants. Do you want to say anything more about that trend?
Sure. Yeah, I think that's a very good point, Jono. And I will say, as I was just mentioning, I think that having a good portion of our revenue coming from member dues is very important because that keeps us independent. At the same time, we've seen increasing interest from institutions, donor institutions, that are either now funding us or I think are starting to think about funding us. And so our grants portfolio has been growing as well. But I think what is extremely important to GHC, both to the board and it should be to the membership as well, is that we have a diversified funding base. Because we know that if you are too heavily dependent on one particular donor and for some reason that donor funding dries up, it can really cut the legs out from under a growing concern and or an organization. So that is also what we're looking at. That we are at this, on the one hand, wanting to maintain a very stable membership base, but at the same time, we're really hoping to diversify the funding as we grow. I would suspect, I hope, that as we go forward, we may see that we're receiving more grants that are project-oriented to help us develop particular areas of work that we've been already investing in, for example, like civil society engagement platforms or coordinating around global health security. So we'll see what happens, but I think that at least right now we see that we are gaining traction. The other thing that I'll note, going back to the question, which was about a fundraising strategy, is that in the work that we're planning to do in 2016 around the strategic plan, we are planning to really review how we have been fundraising and to try to become more deliberate and strategic in the kinds of asks and the kinds of targets that we set around fundraising so that we can, again, really be able to establish a solid financial base and a diversified financial base. I'm just checking to see, I think that we have covered the questions that have come in, and I want to thank everyone for sending these in, and and also just to encourage you, please, if you're in the DC area, please come to our events. They are open. We do have a monthly salon. We love to have people come in for that. One of the things we're trying to do is to expand the geographic reach of our events. So hopefully we will be having some events in, for example, New York or Atlanta or the West Coast over the next year, as well as one thing that I have not spoken to during this call, and I think it's very important to mention, is what is Global Health Council's global reach? I get that question a lot, and I think that it's worth it is really worth touching on during this call. Specifically, we have really looked at, what does it mean for Global Health Council to be calling for having members, dues-paying members from the Global South or from the rest of the world. What we have been finding is that, like with all things in our rapidly evolving landscape, the networks and coalitions and alliances that exist outside of the United States have really expanded, have really grown. And so what we have been prioritizing over the last couple of years is trying to identify networks, coalitions, alliances, both in Europe, the emerging income countries, as well as the Global South and low and middle income countries, to be able to connect with those networks and really build off of their membership and our membership and look at how we can be the most complementary possible, how we can work together. And, for example, what we've found with the work that we've been doing around the Global Financing Facility, among other global initiatives, is that a lot of networks located outside of the U.S. really appreciate the fact that we are located in Washington, D.C., and that we have really fairly easy access to the World Bank, to USAID, and to other organizations, well, and also WHO in Geneva, UNICEF in New York, and that because of where we're positioned, we can advocate for what we're hearing from, for example, Global South networks of around global health. So we're trying to connect and amplify those voices, and also, to the extent possible, play a role in providing complementary actions or activities or voices to be able to provide, to end up with a really complete and comprehensive advocacy and policy platform on global health. So with that, I'm going to note just...
Christine?
Yes?
This is Pat.
Hi,
were
Pat.
you finishing? I
have one last point that I have to make, but please go ahead.
I was just going to mention, I should have mentioned this, that to be on the lookout for the membership ballot that will be sent out in the next few weeks.
Oh yes, thank you, Pat. Yeah, and the next meeting of our board of directors will be in February. So with that, one last point before I move to close the meeting. We have, when GHC relaunched in 2013, we started with a calendar-based membership format, which meant that memberships went from January to December. Throughout the course of 2015, we have been shifting to a new membership management system, and with that we now have the ability to have anniversary date memberships, which means that if an individual or an organization joins GHC, let's say you get off this call and you're so convinced that you go back and you join up today, then your anniversary would be today, or would be, and the same thing if you joined in March or in June or in September. So it would be a 12-month anniversary-based membership. That really is the best practice for membership organizations, and we were very pleased that we were able to make this transition. For organizations that are already members of GHC, because we have been operating on that calendar year member structure, your anniversary date will be January 1st. So there will be no change to that. But organizations that join after we made that transition to this new system will have an anniversary date renewal. So Liz had asked me to make sure to mention that. So with that, I just want to thank everybody for calling in today. I want to thank people for their questions. I want to particularly thank Jono and Pat and Mark for joining me on the call, and I want to thank the Board of Directors for all the support that they've given us. Pat mentioned that it is a working board. It's also an incredibly supportive board, and for anyone listening on this call who works with boards of directors, you'll know that when you can say that you really appreciate the support you get from your board, that's saying a lot, so I feel very fortunate. I look forward to connecting with all of you in 2016. Please keep your eyes out for more information from us about events and opportunities that are coming up. And please do renew your membership dues for 2016. It's important for us to start the year with a robust renewal base so that we know that we are on the right track. And along those lines, again, we will be inviting you in 2016 to provide input and feedback while we undergo the strategic planning refinement process. So with that, I'm going to wish everybody a happy holiday season. It has been a hard end of 2015 globally, I think, and so I hope that 2016 will see us with renewed spirit of partnership and love and collegiality and peace. And I thank everybody who's working in the global health community, because I think that's what drives all of us every day. So with that, please have a happy holiday season, and we will talk with you in 2016.